Even if you do these 10 things every day, your kidneys will not recover. Just picture yourself one day realizing that all your little habits have been quietly hurting your kidneys. Impressive, isn't it? However, this is the truth. The tiny but powerful organs in your body, the kidneys, filter waste, maintain fluid balance, and regulate blood pressure. However, the health of this essential organ could be jeopardized by some of our everyday habits, which we seldom pause to consider. You must be aware of potential obstacles if you intend to keep or restore your kidneys. Watch this video to learn about the top 10 things you do every day that might be hurting your kidneys without you even realizing it. These aren't just little mistakes. They're routines you must abandon if you value your kidney health. Listen closely as we go down the list from 10 to 1, revealing the most detrimental habit at the very end. All right, let's get started. 10. Containing pee. This is a situation that many of us have been in. Too engrossed in what I'm doing to stop and use the restroom. Either that or I'm stuck in traffic. However, there are some serious consequences to holding your pee for long periods of time. Ignoring the need to pee on a regular basis puts strain on your bladder, which can eventually weaken its muscles or cause it to stretch. As a result, the likelihood of developing a urinary tract infection increases due to insufficient bladder emptying. That is not all, though. Serious kidney infections can develop if these infections progress to the kidneys. Furthermore, kidney stones can develop if you routinely hold your pee. Urine minerals have a longer window of opportunity to crystallize. Avoid straining your kidneys by always going to the bathroom when you need to, not just when you're feeling the need. 9. Taking too many painkillers. When we're not feeling well, we usually reach for a painkiller, particularly an NSAID like ibuprofen, aspirin, or naproxen. Although these drugs work well to alleviate pain, they pose a significant risk to your kidneys if you take too much of them. Although they are effective in lowering inflammation, they have the side effect of decreasing blood flow to the kidneys, which can gradually hinder their function. Analgesic nephropathy is a form of kidney damage that can develop into chronic kidney disease if these medications are used regularly. Gradual loss of kidney function can occur as a result of this damage, which is often irreversible. Medication should be used with caution and only when absolutely required. Seek advice from a medical professional to identify potential causes of your pain or safer alternatives if you discover that you require pain medication on a frequent basis. 8. Not getting enough water. The kidneys can't do their job right unless you drink enough water. The kidneys are able to remove waste products from the blood and release them as urine because they are supplied with water. A buildup of waste products occurs when the kidneys are unable to adequately filter excess water from the blood. When you're dehydrated, your urine gets more concentrated, which can irritate your kidneys and eventually cause stones to form. Kidney stones are solid collections of salts and minerals that can irritate the kidneys and lead to severe pain. A gradual decline in kidney function may also occur as a result of chronic dehydration. Staying hydrated all day long can help avoid these problems. An excellent general rule of thumb is to drink 8 or more glasses of water daily, though this number can vary greatly based on things like your activity level and the weather. One way to avoid putting undue stress on your kidneys is to always have a water bottle on hand. 7. Excessive salt consumption, although it may not be immediately apparent. Salt can be a silent killer of your kidneys if consumed in excess. Most diets contain salt. Sodium, the primary element in salt, is essential for proper bodily fluid balance, nerve transmission, and muscle contraction. But when you eat too much salt, your kidneys have to work extra hard to remove all that sodium from your blood. Your kidneys will have to work harder to compensate, and they may eventually start to fail you because of it. When you eat too much salt, your body retains water, which raises your blood pressure and blood volume. Chronic kidney disease and other forms of kidney damage can be worsened by high blood pressure. Kidney stones are painful and can damage your kidneys in the long run. A high-sodium diet can increase your risk of developing them. Cut back on processed and fast food, which are notorious for their hidden sodium content, if you want to keep your kidneys healthy. If you want a more natural way to flavor your food, use fresh produce and herbs. A diet high in processed foods, a hidden cost to your kidney health, is the convenience, flavor, and time savings of processed foods. Your kidneys can eventually feel the effects of the excess sodium, sugar, bad fats, and preservatives found in these foods. Processed foods' high sodium content is especially worrisome because it raises blood pressure, which in turn increases the likelihood of kidney disease. The kidneys already have a tough enough job keeping the body's acid-base balance in check, and eating processed foods, which are often lacking in important nutrients and heavy in additives, can make matters worse. In addition to increasing the risk of diabetes and hypertension, two of the most common causes of kidney damage, regular consumption of processed foods, can cause weight gain and obesity. To protect your kidneys, eat more whole, natural foods such as fruits, vegetables, whole grains, lean meats, and healthy fats, and less processed foods. The nutrients your kidneys need to function optimally are provided by home-cooked meals made from fresh ingredients, which supports your overall health. 5. Skipping tests for hypertension. Many people don't realize how high blood pressure affects kidney health, despite the fact that it is a major cause of kidney damage. The kidneys, like all of your body's blood vessels, feel the effects of persistently high blood pressure. When your blood vessels are damaged by high blood pressure, they lose their ability to filter out waste and excess fluids from your blood. Hypertensive nephropathy, in which the kidneys gradually become damaged and lose their capacity to filter blood efficiently, can develop as a result of this over time. Failure of the kidneys, necessitating dialysis or a kidney transplant, can be precipitated by untreated hypertension, which speeds up the course of chronic renal disease. To keep your kidneys healthy, controlling your blood pressure is essential. For this, it's best to make some adjustments to your daily routine, such as eating less salt, exercising more, getting less stressed out, cutting back on alcohol, and, if required, taking any medication your doctor has prescribed. Keeping a close eye on your blood pressure readings at home on a regular basis can also help you catch changes early and prevent more serious complications. Just wanted to give you a heads up that we've linked to all the top-selling health supplements on Amazon in the description and comment box below. Just wanted to share that with you before we get into the next habit. For easy access to the best options and support on your path to kidney health, be sure to check them out. For eating an excessive amount of sugar, many of the foods and drinks we consume contain sugar, even though they don't necessarily have a sweet flavor. Indulging once in a while is okay, but eating too much sugar on a regular basis is harmful to your kidneys. Obesity and weight gain are the first symptoms of the many health issues caused by a sugar-heavy diet. The kidneys have a harder time filtering waste and keeping the body's fluid and electrolyte balance when you're overweight. In addition, developing type 2 diabetes, a disease characterized by high blood sugar levels that can damage the kidney's blood vessels and cause diabetic nephropathy, is associated with a sugar-heavy diet. This is a leading cause of kidney disease and, if left untreated, can cause kidney failure. In addition to putting additional stress on your kidneys and hastening their damage, sugar is a key factor in hypertension. Reduce sugar consumption if you care about your kidneys. Reduce your consumption of sugary drinks, processed snacks, and sweets by reading labels carefully. For a sweeter taste without the added sugar, try using fruits as a sweetener or spices like cinnamon or vanilla. Thirdly, smoking has well-documented negative effects on cardiovascular health and lung function, but few realize that it also has serious consequences for kidney function. The kidneys are particularly vulnerable to the inflammatory effects and damage to the fragile blood vessels caused by the toxic chemicals that enter the bloodstream through smoking. A buildup of toxins in the body can occur when this damage impairs the kidney's capacity to filter blood effectively. Chronic kidney disease is already a serious health risk, and smoking further lowers blood flow to the kidneys, making them even less effective. Kidney cancer is a terrible and potentially fatal disease, and smokers have an increased risk of getting it. People who smoke heavily or have a long smoking history are at a higher risk. Tobacco use not only causes kidney damage, but also exacerbates hypertension and diabetes, two of the leading causes of kidney disease. The good news is that even long-term smokers can benefit greatly from quitting, since it improves kidney health, reducing the strain on your kidneys and the risk of kidney disease. Your blood circulation improves within weeks of quitting. Do not hesitate to seek help if you feel you need it. There are numerous resources available to assist you in quitting, such as support groups and nicotine replacement therapies. 2. Drinking excess alcohol is commonly thought of as a social or stress reliever, but chronic heavy drinking is harmful to the kidneys. Alcohol is a powerful poison, and your kidneys are in charge of filtering it out of your blood. Excessive alcohol consumption places a strain on the kidneys because they have to work harder to excrete the drug. This can cause dehydration, which is already hard on the kidneys. Your kidneys' capacity to filter waste and keep your body's fluid and electrolyte levels in a healthy balance is impaired when you're dehydrated because less blood flows to them. Since the kidneys and liver collaborate closely to cleanse a body of toxins, chronic alcohol consumption can harm the liver, which impacts kidney function. Another major risk factor for kidney disease is hypertension, which can be worsened by drinking too much. The inability of the kidneys to function normally due to alcohol-induced kidney damage increases the risk of chronic kidney disease and kidney failure, which can develop over time as a result of heavy drinking. Drinking alcohol in moderation can help keep your kidneys healthy. Drinking no more than 1 drink daily for women and 2 drinks daily for men is the recommended limit. Talk to your doctor or join a support group if you're having trouble sticking to these restrictions. 1. Skipping over diabetes care. Effective management of diabetes is the single most important component in determining the state of your kidneys. Because diabetes is the primary cause of CKD, kidney failure, and chronic kidney disease, controlling blood sugar levels is of the utmost importance. The small blood vessels in the kidneys can be damaged by high blood sugar levels in diabetics, which hinders their capacity to filter waste and excess fluids from the blood. Diabetic nephropathy is a chronic kidney disease that damages kidneys over time. It can develop into end-stage renal disease, necessitating dialysis or a kidney transplant, if not addressed. Because high blood sugar damage is often permanent, it is crucial to intervene early and prevent the condition. To keep diabetes under control, it's important to check blood sugar levels often, eat healthily, exercise frequently, and take medicine as prescribed. Other risk factors, like high cholesterol and blood pressure, can exacerbate kidney damage, so it's crucial to manage them as well. You can safeguard your kidney health for many years to come and drastically lower your risk of kidney problems by being careful and proactive about managing your diabetes. Here you have it, 10 things you do every day that might be harming your kidneys without you even realizing it. Each of these habits, from holding pee to ignoring diabetes management, can lead to major complications in the long run. The good news is that you can greatly enhance your kidney health and general wellness by learning about these risks and incorporating small adjustments into your daily routine. One of the finest investments you can make in your long-term health is to take care of your kidneys, since they are crucial to your body's functioning. Also, while you're on Amazon, be sure to look at the recommended and best-selling supplements. In the description below, you can locate the links. If you're on a quest to improve your health, these links will lead you to the best products at the best prices. For more health tips from Health Hacks, subscribe, like, and share this video if it helped you understand the importance of protecting your kidneys. Maintain your health and stay informed.